If you're over 65 years of age, this video will show you the best 10 daily exercises that are safe and gentle to do. These exercises were chosen specifically for aging bodies. They're not extreme, they're not too aggressive, and they're not designed for people in their 20s. They're designed for people over the age of 65. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 35 years. I'm the author of 11 books, the founder of National Health Day in Canada, and I'm very honored to say that we've been voted Ottawa's best 18 times. I've also had the privilege of working with some of the world's top athletes. Most importantly, I've helped guide thousands of patients over the age of 65 using gentle, daily movement, just like what I'm about to show you. Many of the patients have experienced improved balance, better strength, reduced stiffness, easier walking, and more confidence in their day-to-day movement. Now, if you're worried about exercising because you have arthritis, bad knees, knee replacements, hip replacements, shoulder pain, wrist arthritis, sciatica, back pain, balance issues, muscle weakness, limited mobility after an injury, or even the fear of falling, you're not alone. We hear these concerns every single day in my practice. That's exactly why these exercises were hand-picked. They're gentle, they're practical, they can be done at home, and they're designed with joint protection, safety, and confidence in mind. I see these challenges in my patients every day, and that's why I truly understand your concerns. These exercises are easy to follow, they're adaptable to different ability levels, and they may help you stay stronger, steadier, and more independent as you age. Now, before we begin, let me briefly explain the plan for today. These 10 exercises were carefully chosen to gently move your entire body and your major joints, including the neck, the spine, the hips, the knees, and the ankles. They're designed for people over 65 who want to stay mobile, steady, and confident without overloading their joints. We start with mobility exercises for the neck, spine, hips, and lower back, because stiffness in these areas is very common with arthritis, with disc bulges, lumbar stenosis, and general wear and tear over time. Gentle movement may help reduce stiffness and make everyday movement feel easier. Next, we move into gentle stretches for the hips, the legs, the chest, and the shoulders. Tight muscles are common after knee replacement, hip replacement, back pain, or long periods of sitting, and stretching may help reduce tension and support better posture and comfort. Then we focus on balance exercises, which are especially important if you've noticed changes in steadiness, leg pain, arthritis, or concerns about falling. These movements help train the hips, knees, ankles, and balance system. Finally, we finish with simple core strength to support the spine and hips. This may help with walking, standing, reducing strain for those with back pain or disc-related issues. These exercises are meant to be done daily, not to push you, but to keep your body moving safely and consistently. As you follow along, move at your own pace and take breaks when needed. I encourage you to leave a comment and let me know how you're doing, what feels good, and what feels challenging. We're all here to support one another. You can come back to this video anytime and use it as your daily follow-along routine. Now let's begin. The first 4 exercises are for mobility, for the joints, for the spine, and for the hips. Exercise number 1 is seated neck mobility. Very simple, very straightforward. What we're trying to do is just bring movement to all these areas. So for seated neck mobility, we are going to do 10 reps of just bringing the head forward and back upright. Number 2, and back up. Number 3, and back up. These should all be nice and gentle. You're just going through normal range of motion. You notice that I'm not extending the neck backwards. I don't really like that very much because that tends to jam some of the joints. It should be forward and back to neutral, maybe a little bit, but not too much. We're on number 7. 8, 9. You can hold for a bit if you want a second and feel the stretch, but most of this is just going through movement. Okay? That's going to bring blood flow to the area. That's going to actually increase some flexibility and so forth. Then we're going to go side to side, and this is going to be both sides. So that's 1, 2. You should feel a nice stretch in that area. But again, this is not necessarily a stretching motion. It's a movement motion. Side to side. Number 4. So again, what this is doing is it is targeting the neck joints, the upper spine. It's going to help with neck stiffness. It's going to help with those suffering with arthritis. It can help with posture. It can help with, just even head movement. for daily activities as well. All of these things. You want to stay in a comfortable range. This is not about creating pain at all. And part of this will be dependent on exactly what's going on in your neck in the first place. And then last but not least, we can even do some rotation as well. And don't force the rotations, just gentle movement from side to side. So that's one, both sides, two, three. This becomes especially important because as we age, often we lose that mobility, and it's the movement that actually pumps nutrients into the disc. I don't know if you know this. You probably understand that it's your bloodstream that takes nutrients to everywhere in the body. The one place blood vessels don't go is inside a disc. So the way that the disc gets its nutrition is through movement, but the movement has to be specific to each individual vertebrae. Again, just nice and gentle. And what's nice is you don't necessarily even have to sit down and make this your one focus. You could do this during commercials while you're watching TV type of thing. Okay? But just make sure the movements are nice and smooth. Okay? That's number one, seated neck mobility. Moving to exercise number two, this is seated thoracic spine rotation. So again, very simple. We can either cross our arms or we can even put our hands on our thighs. And we're going to start to gently rotate the upper body, just left and right. Okay, so going one way, each way counts as one. So that was one. This is number two. Now, this can also be done standing if you feel more comfortable that way, or if you want to progress once you get to the seated version. It's number three. This is going to target the upper and mid back joints. It's going to help with arthritis in the spine. It's going to help with rounded posture. It can help with upper back stiffness and also breathing comfort as well. So through these exercises, make sure that you breathe normally. You should be inhaling through the nose for a count of 4 if you can. Ideally, hold your breath for a count of 4. It's what we call box breathing. Then you can exhale through the mouth for another count of 4. And then again, if you want, you can even hold for another 4 there as well. But nice, gentle movements. You're not forcing it. You are never trying to push this and get a pop or crack in the spine, even though that may feel better temporarily. It is not a good thing. That's a different video for a different day. Okay? And we're almost done here. Restoring some normal movement back into all the joints in the body. Now let's try exercise number 3, seated pelvic tilts. So we've talked about the pelvic tilt many times. So remember the pelvis, we want to move the pelvis both forward and backwards. Okay? So we can do this seated or we can do this lying down. We're simply going to gently tilt the pelvis forward or backwards. Might be hard for you to see, okay? But feel this in the pelvis. That's 2. Okay? This is going to target the lower back and obviously the pelvis. It may help with lower back pain, disc bulges, lumbar stiffness, spinal awareness. Again, you want to breathe normally as you're going through this. And this is simply a movement backwards and forward with the pelvis. I prefer to do this lying down myself, but for some of you, it may be tough to actually get off on both down to the ground and back up again. The reason I prefer it lying down is what you'll feel is when you do the posterior pelvic tilt, you will actually feel that curve in the lower back flatten against the floor. And when you actually do the movement the opposite way, you're going to feel that arch in the back come off the floor as well. Nice, smooth, controlled movements. Continue to breathe as you're doing this as well. Again, hard to see, but all the movements coming from the pelvis. Okay? It's not a leaning forward and back, of the torso at all. For exercise number 4, we're going to do hip circles. So hip circles, we're just going to stand. You can do the seated if you want as well, but we're going to stand. We're going to support ourselves on the wall, and we're just going to start to circle the hips one at a time. Nice, slow movements. Okay? This is done really easy. We're already on repetition number 4 here. This is going to help with hip arthritis. This is going to help people wanting to avoid hip replacement surgery. It's going to help people recovering from hip replacement surgery. It's going to help walking more comfortable. just even the ease of getting in and out of chairs as well. So we're just circling at the hip joint itself. And of course, we want to do both sides of this. And so same thing. Okay. Now, the nice thing about the hip circles is you can also go both ways. Right? If you started going outwards after 5 hip circles, we can start going the opposite way as well. And you will feel that ever so slightly, ever so differently. And when you're doing this, try to engage the core, engage the abdomen, that abdominal hollow, and so forth. And we're just looking for movement in the area. The next 2 exercises are gentle stretches. Exercise number 5 is going to be the seated hamstring stretch. All we're going to do is we're going to extend one leg out straight while we're seated. We may want to come to the edge of the chair so that we can feel that more. And when we do that, we're just going to gently lean forward. That gives me a good stretch. We go back. Okay. Now again, this is more of a gentle stretch. And normally when people stretch, we ask you to do something that most don't do, is we actually ask you to hold the stretch long enough. And a lot of people are confused with this. They may hold a stretch for, they're told 10 seconds, 20 seconds, 30 seconds, and so forth. What we want you to do is when you're stretching the area, we want you to hold the stretch until you actually feel the stretch ease up. This particular set of exercises, it's more a movement than it is a stretch, but you could get to the point where you would actually hold that stretch. And here's the nice thing, then that way you don't have to count. It's not 10 or 20 or 30. What it is you hold the stretch until the stretch actually eases up on you. Now, the key thing with this is understand your hamstrings attach to what we call your ischial tuberosity. So that's essentially the bottom of the pelvis there. It's really what we call your sits bones. It's actually the bones that you sit on. And so what happens is when we keep that flexibility in there, is you're helping that whole pelvic girdle area in there. But again, here I'm going quicker than the hold for 30, 40, 50 seconds because I want more of a dynamic movement. Then we're going to switch and we're going to do the exact same thing, with the opposite side as well. Normally you would be facing straight ahead as we do this. And you should feel a nice stretch in the back of the leg while you're doing this. This is going to help with everything from arthritis to pelvis issues to knee problems and so forth, because again, those hamstrings also come and attach to the knee as well. Now, the key thing here is because the hamstrings attach to the pelvis, it's that forward movement that then stretches that hamstring, which is what gives you the stretch. If you want to go really crazy and you want to involve some calf movement, then while you're doing this, also pull the toes towards you as well. And now you'll actually start to feel a different stretch, but in the lower leg. But we want to go through that movement that we actually feel that stretch in that hamstring. Now for something different, exercise 6 is going to be the chest and shoulder opener. So we're just gently going to pull our shoulders back. We can do this while we're seated or while we're standing. Again, that means we can do it anywhere. And what we're doing is we're just literally pulling the shoulders back, and we can hold for a count of 2 or 3 when we do this, and then just come forward again. This is going to target the chest, the shoulders, the upper back. We're just getting movement back into the body. We're already up to number 5 when we do this. There are ways of modifying this. And so one of the things that I like to do is think of your shoulder blades at the back, and ideally think of that you're actually squeezing the shoulder blades back together, where they're trying to meet in the back. So if we do that, what that does is that tends to activate the mid and lower traps, which have become weak or inactivated on a lot of people. So we're ready up to number 7. If you want, you could add the arms in like this. If we're adding the arms in, then we could actually change the height of the arms as we do this. And all of these will give sort of different stretches. But again, we're not just going through the motions. Again, remember, if you can, try to squeeze the bottom of the shoulder blades together as you do this, and we actually want you to feel this. Right? So we're already up to number 11 or 12 here as we do this. Okay? But fantastic, it may help shoulder stiffness. It's going to help that rounded posture. It can help breathing in a lot of people as well, give you better upper body comfort and so forth. So for this, minimum 10, but I would actually go to more than that if you can. And again, you can replay this video over and over again. Okay, and simply follow through with me each time we do this. Okay? So that's the chest and shoulder opener. The next 2 exercises are for balance and stability. Exercise number 7 is going to be something I call weight shifts. If we need to, hold in a chair or a counter, and we're just going to gently shift our weight side to side. Okay? When we do this, of course, maintain the core. This is going to target the hips. It's going to target the knees, the ankles, the whole balance system. And it's just a shift back and forth. Something as simple as this, for some people, can actually be difficult, but hold on to something when we do this. It may help with that balance confidence. It's going to help with leg strength. It can help with fall prevention, as we were talking about as well. And as I said, we want to maintain that mobility, and we want to be active. So again, just a simple rocking back and forth, side to side, but nice controlled movements. Remember to breathe while we do this. And again, people always think in terms of 10 reps. You can easily do 20 reps of this, just shifting back and forth. And as you do it. Feel it in the ankles, feel it in the knees, feel it in the hips as we do that. That's number 7, weight shifts. Exercise number 8 is the supported single leg stand. Hold on to some sort of stable surface. Right? It can be a chair, it can be a countertop. And all we're going to do is we're just going to gently lift one foot off the ground. And you're going to hold that for a few seconds. Okay? And then you're going to shift back. As you do that, you're going to feel those hips shift back and forth. Okay? That's all part of the balance. This is going to target leg muscles. This is great for the hips. This is good for the core stabilizers. This may help balance, walking stability, certainly give you confidence, especially on uneven surfaces. If you're at that point where you find it difficult just to stand on the one leg, then you definitely need to start to improve the balance. But for purposes of this exercise, we actually want you to hold on to something just for that extra stability. That's why we're doing this. So I believe we're up to number 9 already. And again, you're just going to hold for 3, 4, 5 seconds. Maintain everything else. Make sure you're breathing. This is where you really need to activate the glutes, because when you shift to the one side, you need the one glute to hold the leg up, or part of what's holding the leg up, and you need the other glute to stabilize the pelvis as you do that. But again, maintain everything else. Maintain that core, suck that belly button up and in. Make sure you're breathing. That's the whole point of the supported single leg stand. So again, you don't have to be that person we were talking about at the start, where this is a one-legged balance test and see how long you can hold type of thing. Right? This is going to be something where we actually want you to be able to improve your ability to do that. So don't be scared, okay, to hang on to that as you're going through that movement. Finally, our last 2 exercises are for core strength and support. Exercise number 9 is seated marching. While you're seated, right, you're just going to lift one knee at a time as if you're marching. Right? And then we're going to repeat that back and forth. Right? What that does is it's actually going to activate the abdominal muscles. You get to decide how long you want to hold this for. Do we hold this for 2, 3, 4 seconds and so forth? Some people, if they want to do more of a march, may actually do that, in a quicker movement. It's going to target the core. It's going to target the hips. It's going to target the thigh muscles. It's just a seated march. This may help with walking strength. Certainly going to help with getting up from chairs, for leg coordination and so forth. So again, we want to look straight ahead. We're engaging all the core muscles when we do this. In this particular one, we're going to do more than 10 reps, just simply because this is such an easy exercise to do. And again, you get to decide. There's ways to advance this movement. So you can advance the movement by simply holding for longer. You could try to advance the movement by marching at a quicker pace if you wanted, type of thing. Okay? There's so many different ways to do this, but technique is imperative. Okay? So look straight ahead, engage the core, pull that belly button up and in. Remember to continue to breathe while you do this. Contract the glutes. But this is going to help build core strength and support. And well done. We've come to exercise number 10, the standing wall push-up. So you're going to have feet shoulder width apart. Okay? You're going to put your hands against the wall, and then we're just going to gently bend and straighten back out the arms. Okay? When we do this, okay, we want to look straight ahead. Again, I know I'm talking to the camera. You want to maintain your core. What's nice here is, depending on the wall placement, that's going to change the pressure on the chest muscles as you do that. Okay, we could come higher, we could come lower. We want to go through these movements. I think that's about number 6 right now. This is going to target your core, your arms, your shoulder, your upper back. Pretty much everyone can do this, right? And the more we do this, the more we will eventually start to build those muscles back, so that we can actually get maybe one day to doing a push-up off the ground again, if that stopped for you. This may help the posture, upper body strength, certainly spinal support, without stressing the joints this way. Okay? So here we're number 10. We're just going to continue this a little bit more. And again, to whatever numbers you want, okay, and however deep down you want to go, maintain the core while you're doing this. That's number 10, the standing wall push-up. You now have a simple daily routine that can be used to keep your joints moving, your balance steady, and your body feeling more confident. I encourage you to come back again tomorrow and follow along with this video so it becomes a guided routine you can rely on. Let me know in the comments which exercises gave you the best benefit. Was it the chest and shoulder opener, or was it the hip circles? Please leave a comment and let me know how your body responded. If you got value from this video, please like it and share it so others over 65 who are looking for safe and gentle movements can benefit as well. And be sure to subscribe to get more videos that focus on simple, practical exercises that may help you move better and feel more confident as you age. If you know you have lumbar stenosis and want to prevent leg pain, heaviness, or difficult walking, go watch this video next on how to walk longer with spinal stenosis without collapsing or numbing legs.